Another busy night of news as we dive into all things people, power, and politics. Welcome to The Pulse, where we are wrapping up a busy week. I'm Taryn Asher. Well, what's supposed to be a conversation between Detroit mayoral candidates and voters goes off the rails. And another escalation in the president's trade war, what this means for us here at home. But 2 Israeli embassy staffers were shot dead. The attack is now raising new security concerns as the Israel-Hamas war rages on. We speak with Aaron Porras, an Israeli journalist who covered the Gaza conflict for years. His insight on this case and the broader battle still unfolding. Also, with the House passing former President Trump's budget, mental health services could take a devastating hit. We speak with a leading advocate who says these cuts could have life and death consequences. The stakes for thousands tonight. But we start with a federal judge halting the Trump administration's order barring foreign student enrollment at Harvard. On Thursday, current international students were also told to transfer or risk losing their visas. Harvard sued, calling the move unconstitutional and retaliation for not going along with the president's political demands. The judge issued the temporary restraining order earlier Friday.
Harvard brought these consequences upon themselves. They have promoted and allowed violent activity on campus. They have allowed anti-Semitism, participation with CCP and Chinese infiltration and influence.
It's another pattern of the Trump administration taking authoritarian actions. In the United States, the president does not have the power to punish people, target people for punishment because he doesn't like their politics.
The judge's ruling puts the Trump administration's order on hold while this lawsuit plays out. Harvard has nearly 7,000 international students. That's more than a quarter of its student body. Trump administration is now targeting, though, another Ivy League school, Columbia University. It accuses Columbia of violating the civil rights of Jewish students, claiming the school ignored growing anti-Semitism on campus. Columbia is already facing $400 million in federal cuts over its response to pro-Palestinian protests. This latest finding doesn't come with new penalties, but a spokesperson says the university is now in talks with the government to resolve the claims. Well, it wasn't your average debate night in Detroit. 8 mayoral candidates took the stage, and so did the tension. Charlie LaDuff moderated the conversation, but things got rowdy as voters fired off tough questions. The first panel heated up over education with a sharp back and forth on who's sending their kids to private versus public school. Then came a brouhaha in panel 2, centered on the Detroit Land Bank and who's really benefiting.
Who do they go to? I have kids that go, and we send them to a private school. And here's the thing. A parent's choice is a parent's choice. And here's the thing. I am a proponent of public schools. This is about the parents who live all across the city. You deserve to be able to send your children to a Detroit public school, period.
That will allow us to take something from our city budget to partner with Detroit Public Schools and our private schools.
Because the land bank right now, it doesn't talk about and serve the people of the city of Detroit. It is a community land trust.
Years ago, I created or submitted a memo to start the process of how we would dismantle the Detroit Land Bank Authority. That was years ago.
Well, we've got a long way to go before the November 4th election. One candidate will replace Mike Duggan as he runs for governor. As we always say, there's never a shortage of political news, so let's pick up the pace and run through some of the other big stories we're following tonight. The Trump administration's threatening more tariffs at this hour. He's proposing a 50% tax on all imports from the European Union, as well as a 25% one on smartphones, unless they're made in the United States. The president says talks with the European Union are going nowhere, but said later he could delay the tariffs if more companies invest in the U.S. And the Supreme Court siding with the Trump administration, saying he likely has the authority to fire independent agency board members. It essentially extended an order Chief Justice John Roberts issued back in April, which removed 2 board members the president fired from agencies dealing with labor issues. Those agencies now don't have enough members to take final action on issues because the president hasn't appointed replacements. The court did suggest, though, it could block an attempt to fire Federal Reserve Chair Jerome Powell. He's been under fire because President Trump doesn't think and has complained that he hasn't aggressively cut interest rates. And the penny is going the way of the disco and Crystal Pepsi. The U.S. Mint made its final order of penny blanks and plans to stop producing the 1-cent piece when those run out. The Treasury expects to save $56 million a year by not producing it. There are about 114 billion pennies in circulation in the U.S., but a lot of people simply don't use them. It's something that has a lot of you talking on social media, believe it or not. Lisa says it makes sense considering it costs more to make than it's worth, while Brian says he usually throws the pennies away. And then Rhonda points out that just because they stop making pennies doesn't mean we can't use them anymore. Well, the Trump administration painting a gloomy picture of American health as they release their Make America Healthy Again report. It lays out a new set of priorities and also calls for increased scrutiny of the childhood vaccine schedule. Vaccines are credited with saving millions of lives, but the report questions if school mandates are necessary. The report, spearheaded by Health and Human Services Secretary Robert F. Kennedy Jr., also claims childhood cancer, obesity, and autism rates have soared the last few decades. But Democrats have criticized massive cuts happening at the agency under his watch.
The first generation of American kids that is going to live shorter lives than their parents. They're going to live less happy lives. They're going to live less healthy lives.
You are implementing changes right now that are ripping away hope and life-saving cures from American families.
President Trump says the Make America Healthy Commission will lay out proposed reforms to address the issues over the next 80 days. Well, new security concerns after 2 Israeli embassy staffers are shot and killed in Washington, D.C. Next on The Pulse, a Detroit native who covered the conflict for a decade gives his perspective on this case and the war at large. You're watching The Pulse on Fox 2. Back now on The Pulse, looking at all things people, power, and politics. Well, the man accused of gunning down 2 Israeli embassy staff members outside a Jewish museum now faces federal murder charges. Memorials continue to grow outside the museum where the tragedy unfolded. Yaron Lashinsky and Sarah Milgram were shot and killed Wednesday night. The suspect, Elias Rodriguez, is charged with the murder of foreign officials and multiple gun offenses. A vigil for Milgram was held in her hometown state of Kansas, where friends remembered her passion for learning and her dedication to helping others.
The thing I think that Sarah would want me to say is, please strive to learn as much as you can. Educate yourself as much as possible so that you can advocate for others in need. If you think you know a lot about something or someone, endeavor to learn more.
Today is a horrible day for the Kansas City Jewish community, but it's even more devastating for the Milgram family. This morning, Bob and Nancy Milgram got the unimaginable call that their beautiful daughter Sarah was murdered in Washington, D.C. She was murdered because she was an employee of the Israel Embassy. She was murdered because she was Jewish. And she was murdered alongside her boyfriend, Yaron.
Prosecutors call this an act of terrorism and investigating it as a hate crime. More charges are expected. And the headline from Jewish News reports the fatal D.C. shooting is a grim validation for those who warned of free Palestinian violence. And to talk more about this, we bring in now Aaron Porras, a Detroit native who spent really the last decade, just came home last year from Israel. You covered the conflicts. You were there when the attack happened. What happened on Wednesday to these 2 young adults? Do you think that this act emboldened the violence of anti-Semitism, that this is going to just get worse from here, that you have somebody who didn't even know these 2 individuals, yet he walked up and shot and killed them?
Absolutely. I don't think there's any question about that. I think that when you have a climate where you're raising the temperature continuously, where one group is saying, hey, this other group is dog whistling about violence constantly, this free Palestine from the river to the sea or intifada revolution. This is what they mean. And for anybody who's saying, well, Some people don't really know what intifada means. It doesn't really matter. It's a word and it has a meaning. It has context. It has a history. And if you look it up, if you just Google Intifada 1, Intifada 2, you know what that looks like. It looks like bus bombings. It looks like attacking random children. It looks like a bombing in the Sbarro pizzeria and killing civilians. It looks like murdering two young people walking out of a Jewish museum.
This happened in 23. You were there, and you covered at least a year of the conflict there. Describe what it was like being there, being Jewish, really. I mean, what were you facing every day?
In Israel, it was from the first several months was just reeling, was just trying to figure out what happened and get bearings. Meanwhile, in Israel, people are looking abroad at some of the protests that were erupting across the West. By the evening of the 7th or the morning of the 8th, in some cases, claiming genocide. The retaliatory attacks hadn't even started. So they were really just reeling. They really couldn't just get their bearings at all.
Why don't you think we can get a handle, though, on this war? I mean, even our own president said that he's, going to go in there and get the hostages freed. What is standing in the way?
I think a misunderstanding, honestly. It's either ignorance or willful ignorance, in a sense, where you have now a situation where Hamas, whether people voted for them or not, are the governing body in Gaza. And as the governing body in Gaza, they decided to invade, launch an attack, a brutal, horrific attack, the likes of which most Americans have no conceptual idea of how bad it actually was, because it was not really shown abroad.
But if you see the film, you will feel it.
It's horrific. And actually, I kind of agree with many of the higher up, the powers that be, who decided not to publish that for the wider public, because it's not really respectful even for the victims and their families. But beyond that, you have a situation where a organization, Hamas, which, if you look at their ideology and the way that they behave when they had autonomy in Gaza and when they were in control, they are ISIS. They are no different ideologically or behaviorally. They invaded a country as a sovereign nation. They attacked them. They took 250 civilians back into Gaza. A response was inevitable. And so the situation at this point is, well, do you want Hamas to stay in power or not? And if the answer is, yes, I want a ceasefire now, no matter what, who cares? Let's even ignore the fact that there are still 57, 58 hostages
but this could
still
happen
there.
Again.
Exactly. If Hamas is not eliminated in the same way that you went into destroy ISIS or any other militant organization, then this is an inevitability in the next couple of years.
It seemed in the beginning of the war there was a separation between Palestinians and then Hamas. Now it seems like it's all backed in one, because there's been so many people killed on both sides. It's very tragic. Of course, no one likes to see this war, but when you're here at home and you're seeing it here in our country, how do we stop this anti-Semitism that seems to be on the rise? I mean, that guy didn't know those two people. This was just because the homeland.
Yeah.
I mean, college campuses have to handle things differently?
Yeah. Absolutely. I can say that I don't know, honestly, what the solution to anti-Semitism is.
Well, I don't think that's exactly what I'm asking, but
it's a morphing beast, and the answer is obviously very complicated, and we don't know. But as far as college campuses and things, and these protests or these encampments or a lot of these things go, simply enforcing the rule of law might be a great place to start. If I'm a student and I'm going to a university, I'm paying $20,000 a year to learn, and I can't get into class unimpeded, or you're stealing from me.
Yeah,
you're stealing from me.
Going to about Benjamin Netanyahu, the prime minister. What about him? I mean, I know everybody thinks differently. It's not all as one, but do you feel most of the people are backing his plan now, because he's not letting up whatsoever, going after these Hamas commanders and military?
So Israel, and this is a cliche stereotype, but it's true. Israel is a robust democracy. There is a healthy opposition. There is an oppositional press and free speech. And people constantly have been protesting since before the war. In fact, that was one of the reasons that Hamas likely thought that they could get away with what they had done, because Israel looked weak because of internal divisions. Those divisions haven't really stopped, and in fact, in many cases, they've exacerbated. So Netanyahu is not necessarily the most popular character in the world. However, what most people in Israel do not disagree with is the war aim, and that in the aftermath of October 7th, 2023, the response, had it been the opposition government, the left liberal government in power, probably would have been very similar.
If this does reach a ceasefire, though, because it is a little muddy with the president, of course, with Netanyahu, but yet also there's Iran backs Hamas and Qatar. And I mean, it's a lot going on, him accepting a plane. Let's say there's a resolution. I mean, do you think there'll ever be a resolution, or do you think that this is always going to be a generational issue where this is going to keep coming back to haunt the Gaza Strip?
I think that it will be, I mean, well, first of all,
it's hard to wrap up.
Yeah, the idea of considering that not all of the hostages will come home is unbearable for most Israelis.
Yes.
That said, if Hamas is allowed to continue to exist, we will be right back here in a couple of years' time.
So that's
really
why the war
will
push on until the job is complete, it sounds like. So, but we do appreciate your insight and, of course, covering it for many, many years. And he is independent journalist, has his own podcast as well. Aaron Porce, thanks for being with us, and hope to talk to you again soon.
Okay.
Well, concerns about Medicaid growing as President Trump's budget bill works its way through Washington. We're talking about the impact cuts to the program could have on mental health initiatives and resources. The Pulse is back in 3 minutes. Well, it's people, power, and politics. Welcome back to Detroit's only nightly political talk show. You know, the big, beautiful bill isn't quite final yet, but many who could be impacted by these cuts are really fearing the worst, especially Medicaid-funded mental health services. And NAMI Michigan Executive Director Kevin Fisher is here. And this is very timely for you. You just came from a meeting where you really discussed the fallout of all of this. What scares you the most when you hear about these potential cuts?
That the people who are making the decisions don't really realize the impact it's going to have on people's lives. Medicaid is a lifeline for millions of Americans that live with mental illness and substance use disorder. And when you take that away, how are we going to care for them? And it's not just them, those individuals and their families, but it's the community at large, because where are they going to go? Where are we going to get services?
There's already a tough time that we've seen for connecting people to resources or knowing where to go if they have mental health issues, or even the stigma that's connected to it. You seem to finally be making some headway, and then all of a sudden these cuts. Explain just how deep they're going to go and the impact with that.
So I was with Michigan Department of Health and Human Services Director Elizabeth Hertel just yesterday morning at our conference. And she was talking about, first of all, Michigan gets about $18 billion in federal funding to support Medicaid in Michigan. That's about 76% of the budget. So I asked her, what's that really going to cost Michiganders in real dollars? And she said, in excess of $1 billion a year.
That's frightening. They would have to come out of the state's budget.
Exactly, would have to come out of the general fund. But in addition to that, where we're already facing significant shortage of behavioral health care professionals and the increase of the need for behavioral health care services is rising. So how do we care for those people? How do we make sure that we're keeping individuals and communities safe?
Well, if someone's having a mental health crisis, or even I need to go fill my prescription, or I need to go to the doctor, what are we going to see? Are we going to see people outside the door being turned away?
Yes. Short answer is yes. When the administration froze the Medicaid dollars back in January, froze all the grants, Medicaid and Medicare is a grant program. The 36 hours that those grants were frozen, my phone was ringing off the hook with people who live with serious mental illness saying, do I need to start a GoFundMe account to get my medication? And many of those people are permanently disabled as a result of their mental illness. So what about my housing and access to food and all of those resources that accompany it?
And then you have the trickle effect, or the domino effect, because if people aren't able to get this through their normal services or their medical offices, where do they go? They go to the ER, right? Or they go to overloaded organizations.
Exactly. So we flood the ER with people who have serious mental health challenges. Most emergency departments aren't equipped to handle that. We've recently started to develop crisis centers or urgent cares for people who are living with mental illness, but we don't have enough of that as well. And as you mentioned, how do you get access to medication? These are real questions that people in Washington can't answer. I was just in D.C. last week meeting with our congressional leadership, urging them to protect Medicaid. This is going to cost us lives, quite frankly, and I'm not being melodramatic when I say that. When we cut that funding, we're going to lose lives.
What do you say, to the people, though, who say we need to just cut the fat? We need to reduce how much we spend, and we don't need to be giving or providing this money always through Medicaid, and that it's going to help us in the long run?
I agree that we need to cut the fat. I'm a taxpayer. I don't want widespread fraud and abuse and all of that, but you use a scalpel, not a chainsaw. And we have the opportunity to do that. Most people who are on Medicaid are not sitting at home playing video games and drawing a fat check. As a matter of fact, our data tells us over 92% of Medicaid recipients in this country either work full or part-time, they're caregivers, or they live with a disability that prohibits them or doesn't allow them to hold a job.
And what's interesting for many people, if they don't have their medication, and we've seen this, we've done the stories, they do have a mental crisis, they can't keep a job. Sometimes then they're arrested, and then you have the fallout of overloading jails and prisons,
which are already overfilled. 70% of the population in our jails in Michigan right now are people who have mental illness or who require mental health care. With the loss of all the state hospitals back in the 90s, our prisons and jails became our de facto mental health treatment facilities. So they're already filled. There's no place else to put them. As they say, there's no room at the end.
With 1 minute left, though, Kevin, what do we do? What do you do? I mean, we have NAMI here in Michigan, NAMI National. We have all these organizations. But what do you do the day those cuts, if they do go into effect?
Hopefully they don't, first of all. We continue. The fight is really just beginning for us. It passed the House, not in the Senate yet. And so I encourage people to reach out to your senators and ask them, demand that they protect Medicaid. But if it happens, we have to, it's a grassroots issue. We have to go back to the grassroots because we have to care for these people. This is not giving people a fat check. This is not enabling people who are sitting at home. These are people who live with real disabilities.
And of course, they need to still encourage people to reach out if they need, mental resources. But day one, when people come knocking on your door and the phone goes ringing off the hook, where do you direct them?
To whatever resources are available. Michigan has a robust community mental health system that provide excellent care, and they're going to continue to do that. I meet with those leaders all the time, and they said, we're going to figure this out. We're going to do whatever we have to do.
Well, let's hope. Thank you, Kevin, though. I really appreciate your insight. You really, seem to know what everything is going to do down the road for us, and hopefully we can hope for the best at this point. Thank you. Well, that is The Pulse. Remember, you can email us your political questions you want answered or fact check if you want to see to The Pulse at Fox.com, or just scan that code, the QR code at your screen. I'm Taryn Asher. Good night, everyone.